Welcome to episode 167. I'm Emily Kircher-Morris. Today's episode is an Ask Me Anything featuring questions submitted by members of the Neurodiversity Podcast Advocacy and Support Group on Facebook. We're doing a new AMA episode every few months, so if you want to join the conversation and be able to contribute your questions, be sure to head over and join the group. There are lots of great people and conversations over there, and we would love to have you. I'm Emily Kircher-Morris, and this is the Neurodiversity Podcast.
What is neurodiversity?
You see the world differently.
Autism spectrum.
Gifted.
Complexities that are inherently inside.
ADHD.
Dysgraphia.
Tourette's.
All brains are different.
You are exactly what this world needs.
This is the
Neurodiversity
Podcast.
Since this is Autism Acceptance Month, we're focusing specifically on questions related to autism. However, I think there are lots of little pieces in here that will be applicable to a wide range of neurodivergent people. If we don't get to your question this time around, don't worry. We're holding on to all of those great questions, and we will try to work them into a future AMA episode. By the way, my new book is being released this week. The second edition of A Parent's Guide to Gifted Children is out on April 11th, so check out the show notes for a link and a discount code to order it. So our first question comes from Jeremy. Jeremy writes, are there any organizations that train and certify practitioners like doctors, therapists, psychologists, psychiatrists, nutritionists, etc., as being neuro-friendly, similar to your training for teachers or others about how to support twice exceptional kids? He says, I know there are ADHD coaching schools that will train and certify you as an ADHD coach, but I'm wondering if there's anything in the way of training and certification for those other specialists. He says, my wife is a psychologist who does assessments and works with lots of neurodivergent kids. A lot of families who arrive at her practice have been through the gauntlet of other practitioners who sent them every which way, and I'm wondering if there are any organizations that help to minimize this and get people to the right place faster. So it's interesting, Jeremy. There are actually some trainings that are available and growing. For example, AutPlay is a neurodiversity affirming program for therapists, and Robert Jason Grant is the clinician who developed this. He's been a guest on the podcast. Mental health clinicians can go through this training and develop some of those neurodiversity affirming tools and strategies. There are programs similar to that are out there, but they're kind of few and far between. And the most difficult thing about it is that it requires families to go out and seek those organizations or programs and then find the providers in their area who offer those services. I will say that our Neurodiversity University, which you mentioned about the Twice Exceptional course, is growing, and we do have some upcoming courses for clinicians, specifically therapists. But it would be great if we did have more training for those in the medical community specifically about what neurodiversity is and how it impacts them in their daily practices. At least to my knowledge, there is no overarching certification or training group, and there is a definite need in the community. If anybody out there knows any of those types of organizations and wants to share those, please let's hop in the Facebook group and we'll start a thread and people can share those so that we can access them as well. So let's move on to Jenny next. Jenny writes, I have ADHD, 8-year-old twin boys. One of them is on the spectrum, and they broke down sobbing the other night due to worries about existential dread. They found out that their teacher's grandmother had passed away, and this led to thinking about his own great-grandparents passing, then down the rabbit hole of what comes after death, and I don't want to die, and I don't want to live with the thought of death, and so on. So Jenny, I have to tell you that we deal with this in our house too. Not all of the kids, but one in particular, who shall remain nameless. But it's really hard because there's not always a lot that we can easily say to ease those fears. One of my favorite TV shows is The Good Place with Kristen Bell. And one of the premises of that show is that all humans are kind of walking around with this sadness and awareness of death kind of at all times. It is kind of heavy, but I do love how the show handles it with levity throughout the entire series. But with that being said, it's hard to have those conversations with your kids. I think sometimes one thing that happens with some of our neurodivergent kids is that when they start having these thoughts, they can almost be an intrusive thought where it just kind of pops in their head and then they don't quite know what to do with it. And that can be really hard for them to kind of figure out where to go because there's not always an easy answer. It's not necessarily an intrusive thought, though. Sometimes they're just reflecting on it and trying to figure out what to do. One of the main ways that neurodivergent brains make connections with other people and show empathy is through connecting their own experiences with other people. So when you're talking about your sons kind of recognizing that their teacher's grandmother passed away and then they're relating that to their own experience, that's kind of what brought out that really strong emotional reaction for them. And we can help to empathize with them and recognize that there's value in having that emotion, that emotion is what brings us closer to other people. So even though it's uncomfortable, we can recognize that it's helping us still to connect with somebody over a sad situation. The other thing to remember is that a lot of times really bright kids are aware of concepts beyond their age, and they don't have the life experience behind them to put it into perspective. So especially if they've never had to deal with death in the past, that can be really overwhelming because it's just an unknown for them. They can also understand both the finality and the universality of death, which is, again, kind of a really big concept. But even though you have the cognitive ability to understand that concept, that doesn't mean that you have the emotional maturity to put it into perspective and understand it and be able to compartmentalize it when that's sometimes what we have to do. So what we have to do is meet them where they are and just kind of walk through that with them and try to help them ease those fears. Another thing that happens is that a lot of times autistic brains really thrive on facts and rationality, so they may not be satisfied with the platitudes that might work for other children. They want to know more information. They can kind of, like you said, go down that rabbit hole, and it's sometimes hard to pull them back. I guess in the long run, recognizing this as a trait of neurodivergence is an asset because having that strong emotional connection, having that awareness in many ways is something that brings us closer to each other and to the world in general, even though it can be really sad and hard to deal with as a parent in the moment. So next is Jenny. There have been all of these ads about Tylenol use during pregnancy and a link to autism. Have you looked into all of this and what are your thoughts on it? I had migraines during my pregnancies and was told the only thing they would recommend was Tylenol. And I think there are many more factors that go into a child being on the spectrum, but it does make you think. I like the perspective of those involved in the community. So let me just say this. When I see these ads on social media, and I get them too, I hide them because they drive me crazy. I really get frustrated by them because it's kind of this anti-vax perspective. People are looking for a cause or a reason that their child is autistic. But let's think about this. First of all, as you mentioned, Tylenol is the only pain medication that you can take at all while you're pregnant. So I want you to name 5 mothers who haven't taken Tylenol when they were pregnant. Right, we all did. So recognizing that it's a difference between correlation and causation is really important. The other thing to consider is the fact that individuals who are autistic while they are pregnant might have an increased sensory need, and so it is possible that they may take Tylenol more than some other parents. However, that doesn't necessarily mean that Tylenol is causing their child to be autistic. In general, I think it's a straw man argument. I haven't seen any research that actually shows this, and I think that it stigmatizes people who are autistic and makes people more afraid of autism than they need to be. So Glenn had this question. I am feeling compelled to explain my autistic oddities and why I have offended or upset others for the past 68 years, but is it worth it? I've told a few people and some just don't want to know and simply dismiss the possibility. Some appear to be accepting, but my inherent distrust affects my interpretation of their reactions. Should I expect the majority to dismiss my life-changing revelation? It's very frustrating. Should I care either way or just put it out there? Take it or leave it. So my question to you, Glenn, would be this. What's the goal of that disclosure? If you can identify what the goal is, it can help you decide whether or not it's worth it. So for example, if your goal is to experience some relief through that sense of self-disclosure and allowing yourself to live authentically and to unmask some of those autistic traits, then that might be a really valuable goal. It might help to improve your overall well-being. There's also the possibility that it might help you to ease or smooth over some current relationships. And again, if that's the intent and that does help those things, then it might be worth it. But you have to just kind of weigh out the outcome. You can always try it a few times, which it sounds like you're doing, kind of float it out there, see what the reaction is, and then you can decide if it's worth it. You might not have enough data to decide if it's worth it just based on your current experiences. It might be really hard, though. You mentioned that it's been 68 years and you've just realized this and you're talking to people about it. But I'm guessing, perhaps, that some of the people that you're sharing this with might also have grown up in generations where they didn't understand autism or really recognize what that meant. So they may not have enough information to know what to do when you disclose that to them. You have to decide how much it's worth as far as the effort and the emotional labor that you put into disclosing that to people, and whether or not you find that it is helpful in your relationships and how you feel about yourself. This was a DM on Facebook from someone who prefers to remain anonymous. I'd like to get your perspective on social skills groups. My son is neurodivergent, and it's challenging to figure out the balance of supporting him to just be his happy, quirky self and learning social skills for a neurotypical world. So the concept of social skills is tricky because often what are considered quote-unquote social skills are really just masking. So, for example, you go to a social skills group to learn how to make eye contact. Well, why are we teaching somebody to make eye contact? It's trying to teach them how to mask, how to blend in. And sometimes that's not always what is best for neurodivergent kids. What I prefer is the idea of reframing those social skills within the context of social acuity, which means learning to understand the situations and respond in a way that is authentic and values autonomy. So we can find ways that kids can blend into this neurotypical world in a way that doesn't cause them to just have to try to hide or suppress who they truly are. There's actually this really interesting thing called the double empathy problem, which is a new way, although it's not really that new, it originally was written about in 2012, but it's a way that we can understand the differences in socializing. So basically what the double empathy problem is stating is that the social and communication difficulties that are present in autistic people when they're socializing with non-autistic people is due to a difference in the lack of understanding that is reciprocal. It goes both directions. And so because of the differences in communication style and in social cognitive characteristics and just the lived experiences of neurodivergent people, it doesn't necessarily mean that there's an inherent deficiency. It's almost like they're speaking different languages, and we have to kind of figure out a way to translate that between the two groups. So a lot of times, autistic individuals are very easily able to socialize and communicate and empathize with other neurodivergent folks. It's just that sometimes we have this gap in the communication style that makes it really difficult. So when we take that into consideration with all of this and within the context of social skills training, we can recognize that it can be a both-and situation. I think it's fair to realize that our neurodivergent kids live in a neurotypical world, and we can try to change the world to be more neurodiversity affirming while also helping our kids develop the skills that are going to allow them to be successful and live the life that they want to live. But one of the biggest things that I advocate for is being really explicit and straightforward with kids about why we are helping them to learn the skills that they are learning. So it's not just that this is the thing you have to do, for example. It's more like, here's what some people might expect you to do in certain situations. You can either do that if you choose, or if that doesn't work for you, you can do what works best for you, but you have to maybe be ready to explain or self-advocate or recognize that the response that you get might not be the one that you really want. If you are looking for some social skills groups, I think that you just have to make sure that you're finding a group that fits based on matching the participants with each other and recognizing that there's not a whole lot of boxed curriculums for those types of groups that are great for the wide range of kids and their various needs. All right, Chelsea writes this. I'd love some life hacks to help children learn how to think about fairness versus mathematics and how maturity levels can vary in the autistic ADHD population. So let's start with the question about fairness. I think that talking about fairness with kids can be hard, especially neurodivergent kids, because they tend to be very fact-oriented and can be somewhat black and white. But I do like the concept that fair doesn't always mean equal. It can be hard because fair does have that mathematical meaning, and that might be what they gravitate to. But most of us have probably seen the image of the three kids who are trying to see over a fence, and there are three boxes, and they all have the same size box. But even when they each have one box, the smallest still can't see over the fence, but the tallest doesn't even need the box. And so then they kind of shift it, and the smallest kid has two boxes, and the tallest has none, and then they can still see over it. So even though they don't have an equal number of boxes, it is fair because they're all able to get what they need. What we have to really emphasize with kids is that we want to meet people where they are. I find that a lot of times siblings really struggle with things not being fair, even though developmentally it might be appropriate. So we could also compare it to the type of work that kids get in school and that they progress gradually. So when they're in kindergarten or first grade, they have certain types of tasks and they have a certain type of help that they get as they're in that grade level. And as they get older, they are expected to be more independent. So the same thing happens as kids have different needs for their social and emotional development that we handle at home. One other note about fairness is that I have seen neurodivergent kids who will refuse accommodations because they feel like the accommodations aren't fair. They feel like they're getting an advantage compared to other students. So I think in this situation, trying to shift the focus away from the product or the grade and onto the process is really important. And recognizing that it's not so much just about what their percentage or their letter grade is at the end, but it's about helping them to learn. And if there are tools or strategies that they need to learn or that other students need to learn, it's okay to meet kids where they are. To answer your second question about maturity levels, I think it's important to note that developmental milestones are benchmarks that are based on an average, but there is no person who literally hits each of those on the nose. An average is an average. We're taking a bunch of different data and we're trying to put it all together and come up with what is quote unquote expected, but it's not necessarily going to follow that path exactly. Development occurs when a child is ready. So we want to make sure that we're presenting kids with opportunities and information, and when their brains are ready, they will leap forward in those areas. We really need to try to shift away from the idea that all kids are on the same trajectory. And we can kind of put this into context as we reflect on the absurdity of how we place all kids whose birthdays fall within a 365-day window in the same grade level classroom, even though there are probably some kids who were ready way before that and some kids who maybe aren't quite ready. So time for one last question, and it's from Sarah. She wants to know how to best enlist support from school for a child who masks really well during the school day, but then the emotional toll shows up at home. So first of all, this can be really difficult, but we need to get the staff on our side. We want them to understand that the things that are happening during the school day are having a big impact at home. And this can be really difficult because teachers only see what they see. One of the best things we can do is really help our own child to effectively and honestly self-advocate. Maybe there's just even one person at the school that they can trust, and they can use that person as a sounding board or that they can go to so that that person's aware of what they're experiencing throughout the school day. We can provide information and tools about neurodiversity to those in the school who are open to learning. And again, try to find ways that we can reduce that overall stress throughout the day. Sometimes kids can communicate about their stress in more discreet ways. So one of my favorite accommodations that I've seen to help kids communicate who were a little bit nervous about it was that they chose to use 3 different colored pencils, a red, yellow, and green, and they just kept them inside their desk. And depending on how they were feeling emotionally, they would put one of those pencils on their desk. It was just a visual cue to their teacher so that they could show if they were feeling comfortable in the green, a little bit stressed in the yellow, or very stressed in the red, but it didn't require them to verbalize it. Beyond this, we can also recognize that a child can qualify for a Section 504 plan if their disability or diagnosis is substantially impacting them, even if that doesn't happen at school. This can be difficult and schools might push back on this, but they might not be aware that it doesn't have to be impacting them literally at school or with their grades for a Section 504 plan. An IEP is a little bit different, but what they need to know is that if there is a situation that's occurring at school that is impacting them elsewhere, they can still qualify for accommodations. I've been in a situation where a student who was masking at school was then getting home and experiencing suicidal ideation and self-injuring because they were so stressed out by everything that was happening at school. The school attempted to deny a 504 plan because they were getting quote-unquote good grades, but that is not legal, and you can go to the Office of Civil Rights and the Section 504 information to get data to support the fact that a student can have accommodations in that situation. It's not reliant on whether or not they're passing or failing their classes. It is always hard to advocate for your kids, but ultimately, we want to do what's best for them and help them to be successful in the future. Part 2 of Sarah's question is about how to inspire an autistic child to persevere when things are getting hard, like executive functioning challenges that finally show up in high school as the academic demands become more rigorous, especially if school has been pretty easy for them so far. So for kids who have had a pretty easy time in school so far, at least academically, it's not unusual for them to engage in what is called goal vaulting. So goal vaulting is kind of this process where kids set a goal for themselves, but as they approach the goal, they raise the bar and make it more difficult. And so then they never really feel like they're accomplishing anything, and the bar is always just beyond their reach. When we help kids really recognize all of those little small steps that go into reaching any goal, they can realize that they have been reaching goals all along, even when it has seemed easy, and that it's that same process that they have to engage in as it gets more difficult. So what we want to help them do is just really start small and work in incremental successes so that they can build that confidence to approach those things. This is kind of the hardest part about this, though. A lot of times we have to recognize that things don't always change until they become problematic. So for example, if I've been getting good grades but have terrible study skills all along the way, I don't really have any incentive to change those study skills until things are difficult. So I hate to give that answer because, of course, we want to build study skills or all of those different things along the way, but sometimes there has to be a little bit of that pressure, a little bit of that pain in order to motivate that change to occur. That's why it's really important that kids are appropriately challenged at schools so that they learn those skills in perseverance and how to tweak their study skills and different things as they go through at a younger age before they hit that wall in middle school or high school or maybe college. And the third part of the question is about finding the right balance between pushing structure and planned activities over summer versus more free time to decompress, especially if you're seeing a lot of autistic burnout that has been happening due to masking behaviors. So I think, first of all, we can collaborate and you can ask your kids what they want, kind of get their feedback about things, and they might have some good insights, but sometimes you also know what's better. And it changes as time goes forward. I have a client right now, and basically they have always needed that summertime to really de-stress and decompress, and it's taken all summer to recover. But recently, over their winter break, all of a sudden it kind of changed, and the decompression process was definitely shorter, but towards the end, they were getting more stressed by just having almost too much time to stay in their thoughts. So as they're looking forward to this next summer, they're definitely looking at something that's more structured than it ever has been in the past. Burnout isn't always healed simply by resting, although that is a main component of it. Sometimes we need to look for authentic communication with peers or something that can be inspiring, and those things can help as well. So maybe there are opportunities out there that can ignite their passion that won't cause more burnout. If we can find those things and give them those opportunities, that might be really great. The last thing that I will mention is to try to check into options that, for example, only require a small deposit, or they offer a refund if you cancel with enough notice, because that way you can have the structure prepared and in place, but you can also keep a check on how they're doing as summer progresses. I have found that it is often easier to take things off the calendar than to try to add them at the last minute. But of course, that varies based on what types of things you're looking at. Hopefully you can find a way to find that balance and help them recharge before the next school year starts. So that's all I've got for this quarter's AMA episode. Thanks again to everybody in the Facebook group who submitted their questions. And again, if we didn't get to your question this time, we are holding on to it and we will try to hit it next time. Thanks again. It's great to spend this time with you. I'm Emily Kircher-Morris. And I'll see you next time on the Neurodiversity Podcast.
This is a service of the Neurodiversity Alliance.